Okay, Kaila. So it's 3:30. Maybe we can start. So hello everyone. Thank you for joining DataCon LA 2020. Welcome to Data for Good Track, and soon you will be listening to COVID-19 impacts on the food system and food security in Los Angeles County session with Dr. Kaila Hay. Ritesh, your host, and your co-host today is Thomas. We'll be moderating the chat and Q&A for you during the session. Today, our guest, Dr. Kaila, will be talking about the COVID impacts. And currently, Kaila is an assistant professor at University of Southern California. And Kaila, over to you then.
Thank you. Welcome, everyone, and thanks for joining this session on Data for Good. So as the host mentioned, my name is Kayla Delahaye. I'm an assistant professor at USC's Keck School of Medicine. And I'll be talking about work that we have started doing during the pandemic to understand food insecurity, and really our big vision for this project that draws on a lot of different data sources to try to get a better handle on shocks to food systems when crises like a pandemic happen. The project was spearheaded by USC's Public Exchange, which is a new office within USC that builds strategic partnerships between USC researchers and public and private partners. And we've also received funding from the USC Dornsife College of Letters, Arts and Sciences and Keck School of Medicine. I'll start by saying that we have a large team working on this project, and the goals of this project have really required a set of multidisciplinary and multi-sector team of collaborators. So this includes several faculty members, students, and staff at USC who are experts in health and policy sciences, as well as spatial and data science. We also have a formal strategic partnership with the LA County Emergency Food Security Branch that was established this year to address the impact on food security in the with community partners such as LA Food Policy Council, an organization that works to create sustainable and equitable food systems in LA. And we have also partnered with Yelp to get access to critical and timely data on food outlets and the food environment changes that are happening. I want to especially thank Michelle Livings, who's a PhD student at the USC Spatial Science Institute, who helped me put these slides together. So I'll start with talking about food insecurity and why we became worried about this issue when the pandemic hit and when there's a lot of things to be worried about. Food insecurity refers to disruptions in regular eating patterns because people lack the money or other resources that they need to get sufficient food. Food insecurity is typically caused by poverty, and people can transition into food insecurity when they experience income loss or with the onset of physical or mental health issues. In a typical year in the US, about 1 in 10 households experience food insecurity at some time during the year. And as you can see on the graph on this slide, which shows the rates of food insecurity in the US for the last 20 years, this rate really spiked from 10% to about 15% after the recession in 2007. And it took almost a decade to return to the typical 10% rate, which isn't really something to aspire to either. We also have historical data on food insecurity in LA County, and traditionally, this is only monitored among low-income households in LA because we often aren't worried about higher income households being food insecure. When I say lower income households, I mean households who are below 300% of the federal poverty line, which is based on their income and the number of people in their home. And the historical data in LA County shows us that over the past few years, typically 1 in 3 low-income households in the county experienced food insecurity at some time during the year. And when we imagine what it's like to experience food insecurity, usually the first thing that comes to mind is hunger. But I want to emphasize that we have a lot of research that has tracked people and their families that have experienced food insecurity over time. And it really shows that the quality of people's diets suffer when they experience food insecurity, and that there are several physical and mental health consequences that can be long lasting. Children that experience food insecurity have a higher risk for asthma, for mental health issues, and for worse overall health. And for adults, food insecurity can lead to depression, poor sleep, as well as a higher risk for obesity, diabetes, and hypertension. So because we know financial and other crises often lead to spikes in food insecurity, and the consequences of this can be long-lasting and detrimental to public health, our team really wanted to understand what is the impact of COVID-19 on people's food access and food insecurity in LA County, and what strategies would really be needed during this pandemic to help people remain food secure. We expected at the outset that the impact of COVID-19 on food insecurity was going to look different to many other disasters. For example, financial crashes that have created poverty and limited consumers' ability to purchase food, or even acute disasters like hurricanes or fires where limited segments of the food system are disabled for brief periods of time. But our expectation was that this pandemic was likely to have a really pervasive impact on many aspects of the food system that you see here, from food production and processing to how food is distributed and consumers' ability to purchase and acquire food around them. We were really uncertain of how resilient this food system would be during a shock like this pandemic, and what the detrimental impacts of this could be on population food security. Some of the challenges to the food system that we began to see documented or hear from our community and government partners were things like shifts in food distribution from schools and restaurants to grocery and food banks, which was causing delays in food being delivered or shortages of key food supplies, as well as food waste. We also saw that many food outlets were closing, restaurants and farmers markets because they were being ordered to, but we also were hearing about other smaller grocery and corner stores that were closing because they were fearful of remaining open or because they couldn't stay open because of illness or a lack of business. Many food outlets were also limiting their opening hours and had limited stock. And nationwide, we've seen a surge in the price of many staple foods, which is actually the biggest consumers have seen since the 1970s. In terms of people being able to acquire and consume food, we were seeing that many people were losing their jobs, making it a lot more difficult to have enough money for food. Unemployment in LA County hit 20% in April and hasn't fully recovered since then. And lower income residents, we were hearing, were really struggling to access food because they lost access to school meals for their kids and other forms of community food assistance that they may have been getting through places like senior centers or faith-based organizations. And on top of all of this, it was scary to go out, and it is scary to go out and get food. People have been sheltering at home at different levels. They're being told not to go out in public spaces unless it's essential to avoid catching the virus. So these are all things that have made it really difficult for people to access food. So our two key goals with this project have been to try and quickly monitor changes to multiple aspects of the food system in LA County, including food insecurity among the residents. And then to try and identify aspects of the food system that have been resilient and helped people remain food secure, as well as features of this system that are contributing to food insecurity that we need to address through food programs or other types of policy that target different aspects of the food system. And our approach to this work has been to work in partnership across different disciplines and different sectors. So our research team brings in expertise in public health, health policy, geography, and data science. I mentioned we're working in close partnership with LA County and their emergency food security branch. And we've been collaborating with community-based organizations and private organizations like Yelp, who are working in the food space. We're trying through these partnerships and a multidisciplinary perspective to draw on different data sources that represent important features of the LA food system and that we can get in a sort of reasonable time frame that help us understand how the system is changing and what we might do about it. And the goal with our analyses is to really integrate these different signals and sources of data to understand how the food system is responding as a whole, so that we can inform more system-wide food interventions and policy. So because this is a data conference, I'll speak a bit more about the data sources that we're drawing on, and then summarize some of our key findings and where we're headed with the next stage of our analysis in this project. So I mentioned that we're really trying to draw on a diverse pipeline of sources of information and data, and I'll briefly describe those here. So one of the key sources of data that we've been drawing on comes from USC's Understanding Coronavirus in America study. This is a panel of about 1,800 adult residents in LA who are sampled to be representative of all LA County households so that we can make population level inferences about what is going on. The panel participants were enrolled, many of them pre-COVID, and were part of earlier panel surveys, but they really oversampled and made sure they had a large sample to track during the pandemic. And they've been tracking them weekly since the start of the pandemic in March actually, using online surveys. And we've been adding questions to those surveys to measure changes in food behaviors, food access, and food security across this representative sample of the LA County population. A second source of data has been big data on food outlets and people's use of these food outlets. So we've partnered with Yelp to access their crowdsourced data on food outlets across LA County and temporal information about how these outlets have been remained open or closed, the hours that they've kept, and things like delivery options that would impact people's food access if they use that outlet. We've also started to work with population mobility data, which is geolocation signals captured by people's cell phones. And again, this is really large population level information about how people move throughout the city that's being used a lot during the pandemic to understand population mixing and whether or not people are staying at home, but that we want to use to give us insight into where people move throughout the city to access food and which food outlets they're visiting, whether it's close to their home or if they're traveling further to get their food. A third source of data that we're drawing on is existing public databases, so including census information and existing LA County data. They have really rich historical information about food access and food security and other health outcomes that we're interested in. And we've also started exploring Nielsen consumer data, which captures weekly snapshots of foods that are purchased at major retailers every week across the US. And the last, but certainly not least important source of information has been obtained by working with these government and community partners who have really invaluable insights about what is going on in the community and in terms of government response and government programs, and how they are tackling food access and food security. And so there's been a lot of information sharing with these partners through conversations, but also things like structured interviews that we've done with food assistance programs to really understand the programs that are available, who's using them, gaps in these services, and some of the challenges and successes that they are facing trying to address food security. So I'm going to jump into some of our findings from the work over the last few months. So first, to answer the question, what has the impact of COVID-19 been on food access and food security in LA? Based on the representative survey data that we collected through the Understanding Coronavirus in America survey, we found that 1 in 4 households in LA County experienced food insecurity during the first 4 months of the pandemic, so between April and the end of July. We're using a standard measure of food insecurity that asks about a range of experiences and is used across the world to assess food security during events like pandemics and disasters, but also to regularly monitor it. So specifically, we're seeing that 26% of all households in LA County, which is close to 900,000 households in the county, experienced food insecurity during this time. And when we look at just low-income households, 42% of those residents had experienced food insecurity during this time frame. And this is much higher than historical rates that we see when we look at the LA County data. So in 2018, 27% of low-income households experienced food insecurity at some point during that entire year. And we were estimating that in a given month, it might be about 5% of those households that experience food insecurity in any one month. So we're seeing that 42% of these low-income households had this experience over just 4 months. We were able to use the survey data to profile the people who experienced food insecurity. So we saw that the majority of them were female, Hispanic, or Latino. The majority were low income, and the majority were 18 to 40 years old. We also saw that half of these households had children living in the home. The other key finding was that the surge in food insecurity during the pandemic has started to affect many more people than it has in the past, including higher income households who typically don't experience food insecurity. And so when we looked at this time frame, almost 1 in 5 of the households that experienced food insecurity were higher income households, most with annual incomes between $60,000 and $100,000. And using statistical regression models, we found that some of the key factors that put someone at risk for food insecurity were having a low income and being unemployed. So some of the risk factors that we typically see for food insecurity. But we also found that during the pandemic, younger adults, particularly those between the ages of 18 and 30, had the highest risk for food insecurity, while adults that were 65 years and older actually had the lowest risk. And over and above these risk factors of income and employment and age, we found that people who were single parents had an added risk of experiencing food insecurity. We also looked to see where these folks were living across LA County, and the people who are experiencing food insecurity during the pandemic really live in particular regions. Almost 1/4 of them live in East LA, and large percentages of these folks resided in Metro LA, the San Gabriel Valley, and South LA. And these are regions that historically have had higher rates of food insecurity. As we tracked food insecurity over time, we did see some positive changes. Food insecurity really peaked in April and May when 26% of the population was food insecure, and it declined substantially by June and July. So by the end of July, about 10% of households and 14% of low-income households were food insecure. And although this is a really great improvement, these rates are still much higher than what we would expect to see in a typical month. So for example, in 2018, I'd mentioned that our county data estimates were that just 5% of low-income households experience food insecurity in a given month. So that's much lower than the 14% of low-income households that we're seeing in midsummer. When we look to see what type of households were remaining food insecure throughout the pandemic from April to July, they tended to be people who were living in poverty, so below the poverty line. Also people who had young children and had fewer family or friends, presumably people they might be able to rely on for food assistance or other types of support. These households were also less likely to have received government financial assistance during the pandemic, like unemployment insurance or coronavirus aid, giving us some initial indications that these types of financial aids might have really helped people remain food secure or recover from food insecurity. And these folks who were consistently food insecure also reported more difficulties getting food. Barriers like just having a hard time getting to food stores. And I'm going to talk about some of these barriers in more detail in a few minutes when we talk about the food environment. The last finding I want to emphasize from the survey data is that we started to document how the pandemic has been impacting people's diets. So about half of the population in LA County reported that their diet hadn't changed since the pandemic has hit, in terms of how much they were eating, as well as the quality of foods that they were eating. But the other half of the population has said that their diet has changed. And people who experience food insecurity seem to have been impacted the most and the most negatively. 63% of people who had experienced regular food insecurity during the pandemic said that they were eating a smaller quantity of foods than they were before, compared to just 7% of people who were food secure that said that they were eating less food. And when we look at diet quality, 44% of people who were experiencing regular food insecurity said that they were eating foods that were less healthy, such as more fried and processed food and less fruits and vegetables, compared to 22% of people who were food secure that said that they were eating less healthy food. So we also have some indication that the diet gaps that we see between higher income and lower income populations in the county that have always existed seem to be exacerbated and are getting worse because of the spikes of food insecurity and shifts in diet during the pandemic. So the second question that I want to address with some findings from both the survey and data that's coming in from the county and other community partners has been the impact of the pandemic on food assistance availability and use. So after that initial food insecurity spike that we saw at the start of the pandemic, we saw rates of food insecurity decline by July, although they're still at levels that are much too high. And this was really paralleled by an increase in the use of food assistance. So both our survey data and data that was coming from LA County documented a 20% increase in the use of CalFresh in LA County. So CalFresh, which is known nationally as the Supplemental Nutrition Assistance Program, or SNAP, is the largest food assistance program in the US. And when we explored the survey data over time, we found that food insecure households who had received CalFresh during the pandemic were about 20% more likely to transition to food security compared to households that didn't receive these food assistance benefits. So we have some preliminary evidence that this program is working as it's intended to do, that its reach has been scaled up as food insecurity has spiked, and that it appears to be helping people who are food insecure transition into food security during the time frame of the pandemic. Our survey data also showed that LA County residents were using a pretty wide range of food assistance programs, and that their use of these programs was really high among households who were experiencing food insecurity. So in addition to the government-funded programs like CalFresh and the Women, Infant, and Children's Program, WIC, 15% of people who were experiencing food insecurity said that they were getting food from food pantries, and 14% additionally said that they were getting food donations from other sources like faith-based organizations. This data that we're seeing in the survey really parallels data that's being reported by LA Regional Food Bank, the largest non-government food assistance program in the county. They are reporting that they're increasing their food distribution by 70% during the pandemic, and they've distributed 22 million meals between April and June. So our current research efforts are focused on trying to map this landscape of food assistance programs and the diversity of these programs across the county, to really get a better sense of what programs have remained open and which new programs have emerged during the pandemic, and to understand where they are located and who has access to them. So from looking at initial searches on searches and interest on Google and websites like findhelp.org, which are used to link users to assistance programs, including food assistance, we're really seeing the emergence of a pretty broad array of different food pantries, emergency food assistance programs, things like grocery and meal delivery, and other help with money or resources for food. And we're also seeing evidence on these sites that users' interest in these programs has been incredibly high during the pandemic, really peaking in April and May, when we also saw the highest rates of food insecurity. And so our next steps will be to try to partner with some of these data sources to map this landscape and spatially to understand where people who are food insecure are living, the extent to which they have access to these various food assistance programs. And that leads me into the final section of our findings and really where we're trying to expand our work the most. And that's looking at the LA County food environment. And so we know that the food environments in which people live impact what they eat and also their ability to easily access food or not. And in LA County, historically, about 1 in 4 LA residents live in what's called a food desert, meaning a spatial area around their home where they don't have close access to a grocery store. And so when we started to look at the impact of the food environment on people's food insecurity in our survey data, we found that of the people who were experiencing regular food insecurity between April and July, that 80% of those folks said that their primary source of food was within 2 miles of their home. And this was much higher than what we observed across the whole population who tended to travel further to get their food. We also saw that about a third of them had difficulty or reported that they had difficulty accessing food because food stores were closed or had limited hours. And a third also said that they were having a hard time getting food because they didn't have personal transportation, which, as you can imagine, normally is a barrier to getting food, but during the pandemic is particularly something that would prevent you from being able to access food in a safe way. When we looked at where people who were food insecure lived, we saw that they were more likely to be living in a food desert that had low vehicle access. 12% of the folks that were food insecure were living in this type of neighborhood where it could be really hard to get food if you didn't have personal transportation. And so the next steps of our analyses really want to look at how these food environments have changed. So that the data that we're able to access through USDA on food deserts is historic data that isn't updated quickly. And so our goal was really to find information about how food environments and grocery stores and food outlets, those environments were changing during the pandemic. And so that's why we decided to approach and partner with Yelp, who have this amazing and rich source of information that is fine-grained both spatially and over time, that gives us some great insights into how food outlets and food environments have changed during the pandemic. So Yelp has been curating and collating data on whether any store in their system, but including food outlets, have remained open or closed, what their hours have been and if they've been limiting their hours. And they've also tracked things like access to food delivery services. And so this is all data that we've just started working with, but that we will be looking to understand how food outlets and different types of food outlets have changed over time and how specific food environments in LA County have changed over time. And one of the things that we really would like to understand is how this lays out onto what we know are historical food deserts in the county. So have these food deserts expanded, have key sources of food, corner stores, sources of grocery, have they closed or limited their hours? And has the severity of these food deserts increased because of the pandemic and some of these changes? What we're hearing from our community partners is that these food desert neighborhoods, which historically don't have large chain grocery stores, are really the ones whose food environments have been impacted the most by business closures and changes in the food system. So lastly, the last piece of this puzzle with the food environment and people's food access and food security is really trying to understand in more depth how people are using the food environment. And we expect that has really changed as people have sheltered at home and not been going to work or school, and the sources of their food may be becoming more localized. So when we track this in our survey data, we find that people are saying that supermarkets and big box stores like Costco and Walmart are really remaining the primary source of food for people. And this graphic depicts the travel distances that the LA County population are saying that they're traveling to their primary source of food. The majority of people within a couple miles, but you also see a quarter of the population traveling further than that. And so to understand this in more depth, this is where we want to bring in, and we're starting to bring in the mobility data, which really allows us to see where people travel from their home environments and which food outlets they go along their daily routes over time, with a very rich picture of information across the population and across the stages of the pandemic, to understand which outlets are still attracting people and where people are really having to go to get food, particularly if they live in food deserts and their access might have diminished. So all of this data is what we're working on bringing together to understand what strategies are needed to support food security and food justice during the pandemic. And so our big picture goals really are to identify features of this food system that are either helping people remain food secure or contributing to food insecurity, thinking about the food environment and those environments that might have been the hardest hit and exacerbating this risk for people that live in them, trying to understand what these corridors of food access are and how they've changed during the pandemic, and how that gives certain people access to different food environments or not. The role that these programs are playing in people's access to food, particularly when they're low income or food insecure, and whether or not they're accessing these broad-based government programs, and to what extent these smaller, more localized programs, particularly those that are around their neighborhood, are contributing to them being able to remain food secure. And over the next 6 months, we'll continue to monitor food insecurity through to the end of 2020 through the Understanding Coronavirus in America survey, to begin to model in much more detail how these factors are contributing to food insecurity and people's abilities to transition. And so I'll end on this slide just emphasizing, our overall aspirations with this project of integrating these different data sources conceptually, but also doing the work to model how they're integrated, to understand the food system as a whole, and identify those people and those areas most in need of additional food assistance, and to try to do that in a way that isn't waiting for a survey or national data that might come in a year or two that might inform the next pandemic, but really trying to do it in a way through partnerships and through rich real-time data sources that might help us understand this as the pandemic unfolds, and really intervene in real time as this is happening. And the long-term goals with this work are really to understand ways in which we can monitor food systems when there's not crises, but when crises unfold. And can we use this type of monitoring and modeling system to strengthen food systems in the future and food justice and the equitable access to food across our population? So I will end there. Sorry, I went a few minutes over. I was hoping to leave more time for questions, but I think we still have several minutes.
Thank you, Kyla, for the presentation. Yeah, I think we have a few questions. I'll just read out few questions. What work have you done to understand the end user's experience in this rapidly changing food environment? What efforts have there been to provide updated information to help families locate food assistance?
Okay, so I'll tackle the last part of that question because it's fresh in my mind. So what I heard from that question is, how are we using this information to help families, get assistance and recover from food insecurity? So really the biggest way that we're doing that is by having this close working partnership with LA County Emergency Food Security Branch and our community partners. So all of the findings that I've just shared, we've put out rapidly in reports that were released in June and then again last month that go directly to LA County we've briefed LA County supervisors, food assistance programs, and those findings have directly led to the county and food assistance programs making decisions about how, who they still need to reach, where resources need to be allocated. And even in LA City, they passed a motion just this week to allocate more resources to food insecurity, citing a lot of the findings that we put out just a few weeks ago. So that's really been the biggest impact of trying to get this information out to the folks that are allocating money or resources to food programs, and the county has really scaled up their efforts and used federal dollars that they've been receiving to be able to do that.
Thank you. The second question we have is, how do you capture food source availability and use? Like pipeline of data slide under government and community partners section.
Sorry, I didn't quite hear the last part of that question. So how do we capture food source availability?
Availability and use. Yeah, I think
okay.
From one of your slides, pipeline of data slide.
Yep. So we're trying to get at this both from the perspective of people and then from an environmental and spatial perspective. And so we're using both the survey to ask people where are they going to get food? How far do they travel? Are they experiencing barriers to getting food, such as not having a car? And so we've been able to profile people in the LA County population who say that they're having a hard time getting food and where those sources are. So that's one perspective. And what we're trying to overlay that with is this food environment perspective. So by really thinking of this spatially and mapping where food outlets are in LA County and which neighborhoods have very few grocery stores or might rely on just a couple of corner stores or bodegas or a farmer's market for fresh food. Looking particularly at those spaces and using the Yelp data to see how those spaces have changed. So, for someone who is likely low income and lives in a food desert in South LA where they have very limited grocery options, does the Yelp data give us some insight into what's happening with the food outlets in that neighborhood? Has the bodega closed, or does it have really limited hours? Has their ability to access food nearby been restricted even more? And the food mobility data, so really using that cell phone data, will help us give us insights into people in that neighborhood. Where are they going to get food? So do we observe them through these geolocation pings, just seeking food at the very few food options in their local neighborhood? And that may be fast food or very limited grocery options. Do we see them having to take buses to travel out, every few weeks to try to get access to food outside of their neighborhood? And that's particularly difficult with coronavirus, and if you don't have personal transportation especially. So those are the pieces that we're trying to bring together to understand that food access piece.
Yeah, thank you, Kyla. I think there are a couple of more questions, but we are already out on time. So thank you for your presentation, and I really appreciate all the attendees. Kyla, if you like, you can still see the question and answers in VOA.
Yeah, I'll check in on there after. Yeah, thanks so much for monitoring them, and thanks so much for the great questions.
Yeah, sure. So thank you, and have a wonderful day, and thanks for being a part of DataCon LA, everyone. Thanks a lot.
Bye.